Members of the community have had justifiably some concerns about reliability of supplements, how to choose supplements and herbal products. And it's a tough one. It's a tough question to answer. And again, I'm going to come back to one of my favorite themes: be in contact with a medical provider that you feel comfortable with, who's trustworthy and reliable, et cetera. Because what you really want to be looking for is some medical data on reliability of your products. I always encourage people to look for literature, on different products. If there is any, there may not be, things like PubMed.gov may be a little tricky to use, but you can find what's out there, and see if there is any literature. And I think you want to know about drug-drug interactions. Sometimes my patients will come in and say to me, Mary Jane, I've tried this fabulous supplement and it's really great. And that it's evening primrose oil or something like that. Now, I like evening primrose oil for certain purposes, but there's really no data to show that it really helps with menopausal symptoms, with hot flashes, night sweats, etc. Now, my attitude, though, is if somebody says, I am feeling great with it and it's working, fine. That's all right, because I think it's a pretty safe substance. I think there's a pretty good amount of data on evening primrose oil. The problem is there's a significant what we call placebo effect, that things will seem to get people better because they want them to get better, that sort of thing. And so there really is no good data out there showing that evening primrose oil is any better than placebo. But my attitude is, hey, it's safe. You're better, I'm delighted, And the thing about something like Remifemin, a supplement that I do recommend regularly, is the fact that there is good prospective randomized double-blind controlled data, both from an efficacy point of view, is it effective, and is it safe? And we have plenty of data, on these large prospective randomized trials. And so if somebody, if somebody says, I'd like something that there's data, well, there just isn't a lot of data on many things as far as effectiveness that's greater than placebo. Many people have a belief that natural is better, so if it comes from nature and it hasn't been processed, which all these things have been, that it must be better. Among the most popular ones, indeed, are things, for example, like rhubarb, which, I like rhubarb pie, it's good. But as far as efficacy, as far as hot flashes, not really a lot of data there. And again, the products are so variable that there's not one rhubarb product that stands out to say this is the gold standard to which everything else has been tested. So again, I doubt that it's got much danger to it, but there also is no data showing efficacy. But again, if somebody's feeling better with it, okay, great. But would I push my patients to take it? No. As far as other products that are out there, soy is another product that's been, that certainly has been touted, and soy definitely has some efficacy in some of its studies. There are some real scientific studies out there with soy showing efficacy. The problem we have is, again, there's very little regulation of what's in the different soy products as far as do they have the real product in there, stuff like that. We know certain brands probably do, but some of the generic brands out there probably don't. And of course, one of the concerns about soy that's been out there is its mechanism of action. We know there is data showing efficacy, that it does help with hot flashes. However, some of patients' concerns, people's concerns in general, is its mechanism basically estrogen? It contains weak plant estrogens, phytoestrogens. And again, some people are concerned, oh, gee, if it's got phytoestrogens in it, maybe it's not good for my breast. The concern expands. And some oncologists actually espouse that. So whenever I have a patient who is a breast cancer patient and she asks me about soy, I say, look, to my knowledge, soy is not a problem, but you better talk to your oncologist because some of them do have concerns about it. Now, the one thing that I can tell you about soy is the fact that it actually may have, it can bind to the estrogen receptor. But the key thing is, does it act more like a drug like tamoxifen, which is called a SERM, selective estrogen receptor modulator, which actually blocks estrogen activity? And does soy, a very weak plant estrogen, block stronger plant estrogens? It's out there. I can't tell you we have the definitive answer, but I can tell you there is some controversy in the field among oncologists, so that's out there. As far as other substances, valerian is one that comes up. What I can say, for example, is the makers of Remifemin Goodnight have looked at valerian as an ingredient, and they have that in Remifemin Goodnight, and it certainly does seem to have sleep efficacy. It does seem to help with sleep. So based on that, now of course it has a couple of other ingredients. Is it the valerian alone that's doing it? Hard to say, but certainly it does have efficacy, and it certainly has safety. What's in the other products? I don't know. So that's again, gets back to, are all products created equal? And I really got no data on that to tell people about. Whereas Remifemin is statistically significantly better than placebo on many factors for the hot flashes, night sweats, quality of life issues, for which we have data. And that's what I like to see, is safety and efficacy. Now, if one of my patients comes to me and says, Mary Jane, I've tried this new stuff and my hot flashes are really responding well, and she tells me she's taken arsenic, I'm probably not going to encourage her to continue with that, because that would be very dangerous. So the key thing is, when somebody finds something that seems to work, if it's safe, I'm okay with it as long as I've got a good safety record with it.